Good morning. What an honor. Thank you so much for having me here. My name is Aleeza Granote. I'm a pediatric oncology social worker at SSM Cardinal Glennon Children's Medical Center. When people first learn my profession, the first thing they usually say is, "What a tough job." To some, the thought of being so closely involved with children facing the ravages of cancer or the immeasurable loss of a terminal child seems unthinkable. And it's true, it can be difficult. It can be truly heart-wrenching at times. But despite this reality, it's wonderful to witness the genuine concern, compassion, and sensitivity to the needs of everyone involved when a child is diagnosed with cancer. People want to help, but it takes initiative to turn that concern into something real. Taking initiative is a challenge we all face, and it's one that I'm personally passionate about. As you already know, the challenges facing SSM patients are often more than just medical in nature. When confronted with a variety of social challenges, I have learned you simply have to start somewhere and have the conviction to see it through. It's a lesson I learned from my father. He was able to create an ornamental iron business after immigrating to America with one suitcase and $100. He began his business by going door to door seeking clients. He taught me that courage and perseverance can go a long way. I apply this lesson to my work with families each day. For instance, I was recently approached by a mother of one of our patients. She was a Middle Eastern immigrant who had only been in the country for a few months and spoke almost no English. She appeared shaken and anxious when she approached me, and only through the assistance of a phone interpreter was she able to express to me in detail the horrific abuse she was suffering at the hands of her husband. I was moved by her courage to come to me in the face of such obstacles. At the same time, I remember thinking to myself, how would I begin to help this mother who had absolutely no money, job, or support system? We both understood the magnitudes of these barriers, yet she had confided her struggle to me, believing and trusting that I would take action. I was determined to empower this mother to move forward and create a brighter future for herself and her children. So I applied my father's lesson. As soon as she told me, I tried to show her compassion and reassurance that we would find a solution. From there, I became her advocate, making calls and using resources to ultimately provide her with an apartment and her family's basic needs. Stories like hers will always reinforce my own conviction to be proactive, but in many cases, I have found it's the little actions that often mean the most. By providing hope and encouragement to support this mother's own courage and conviction, she became further determined to empower herself and find her own path. The little gestures of kindness and the steps taken to go the extra mile for our patients can have a lasting impact beyond our own understanding. As healthcare professionals, we have an incredible ability to influence more than just physical healing. Sometimes it is simple as giving extra effort when we identify a problem. In one case, a young hospitalized patient was tearful and upset because she was missing her school's field day. Seeing her distress, I was able to rally the oncology team, and we created a Cardinal Glennon field day that day, complete with obstacle courses and a variety of outdoor games. Within 3 hours, the patients came out with their IV poles, gowns, and masks to participate and socialize with each other. It was heartwarming to see the smiles and watch the kids enjoy themselves. In another case, after witnessing a patient struggle with academics because they missed more than average schooling, we started a reading program to promote independent learning. Patients would run into the clinic with their reading form in hand, excited to show me their progress. On other occasions, I implemented a Build-A-Bear Fun Day and a Dearborg's cooking class to bring joy during their struggles. These activities have allowed the kids to get their minds off treatment and be kids. Through dedication and the giving spirit of others, these special moments became a reality. As great as it is to celebrate milestones and the joys that mark a patient's journey to recovery, the death of patients is also a devastating reality in the healthcare sector. It's in these moments that we often feel the most helpless. Not only is it difficult to accept the limitations of our skills, but too often these moments may seem intensely personal, as if we're intruders to the last moments a family may share together. Experiencing a loss is traumatic and devastating, but having love and compassion for those families can bring some light into a dark situation. I recall one 7-year-old oncology patient with a terminal diagnosis who is in a particularly difficult situation. His parents were both drug abusers who had been jailed on criminal charges. In addition to lacking a stable parental presence, he and his siblings were homeless prior to his diagnosis as a result of a drug-related explosion in their home. Knowing how little time he had left, I worked closely with his aunt to help her gain legal custody of him. It was an uphill battle to navigate the legal system, but it meant the world to him to have someone that he could officially call mom. During his final months, I helped his family celebrate significant firsts. These firsts included a family vacation, a trip to the beach, weekend excursions, and his own bedroom. In his final days, our team was able to create a half-birthday party, complete with a personalized cake, tasty treats, and family activities. Although we could not control his cancer, our actions gave him and his loved ones the space to focus on what he could control, making family memories and creating joyful moments with each other. I mention these examples as a desire to share the importance of taking initiative and having compassion for others. Several years ago, I realized that so many of my oncology patients were isolated and lacked strong support systems. After witnessing this unfortunate situation, I created Card Care Connection, a 501c3 organization that provides handmade cards and care packages to people with cancer. This program lifts spirits during a difficult time. This program also benefits patients within SSM and across the country. Card Care Connection was born from a simple idea, sending a token of encouragement to show patients that a supporter, a community rooted for them. Today, that impact has not only spread to include care packages, but also a network of resources, friends, and advocates to provide psychosocial support and promote holistic healing. As you know, healing is more than just physical recovery. We should never underestimate what it means to be surrounded with hope, kindness, and encouragement. Our lives are connected to those around us, and we each have the ability to change the world for someone, no matter how small. Never think that your actions are unimportant. Maya Angelou once said, "I've learned that people will forget what you said, people will forget what you did, but people will never forget how you made them feel." In honor of these words, I encourage everyone to seek out solutions to the problems and face the challenges that lie before us. Take the initiative in your own way. Have the courage to take the first step, and together we can make the world a better place. Thanks.